Yeah, this is the 27th question. You can go through this. This is the 27th question. You can go through this. Study this question carefully. You hear a community nurse. You hear a community nurse talking to a patient. Okay. Right? So far, so good. What is the patient concerned about? Okay. What is the patient concerned about? So a community nurse, right? A community nurse. She is talking to, okay, a patient. So now nurse consultation. So what is the patient concerned about? So nurse, maybe male or female. Nurse, maybe male or female. Nurse, if the nurse is male, the patient will be female. Okay, because, and then now I'm going to teach you another angle. Okay, last question, I have told you that there will be one male voice, there will be one female voice. Now I'm going to show you one thing here. So what you have to listen, who should you listen? Should you listen to the community nurse more, or should you listen to the patient's word more? Where will the answer come from? So what is the patient? What is the patient concerned about? About what? So patient is concerned about. So patient is important here. You should, now you will have two voices. One community nurse voice, one patient voice. So you will see them discussing. So he will say, or she will say some things. Now, you should focus more on the patient because patient is concerned about something. Patient is concerned about something. So about what? Is it about the recurrence? Okay. Or is it about the discomfort? Or is it about the changes? Okay. So, is it about the condition? Or about the surgery? Or about the growth? So there are different angles you can see here. Okay. Recurrence of the condition. Recurrence means reoccurrence. Recurrence means reoccurrence. Recurrence means reoccurrence. Reoccurrence is a very powerful word. C2 vocabulary. Okay. So the possible recurrence of the condition. So the condition, okay, became normal. Then again it may come, it may reoccur, come back. So recurrence of the condition. Or next one, discomfort in the site of the previous injury. Discomfort, uncomfortable situation, because there was a surgery before. So this is the medical condition, recurrence of a condition. This is discomfort regarding the surgery, which was done earlier, and changes to a growth. Okay, changes to a growth that's already been examined. So changes to the growth that's already been examined. So you have to think about recurrence, means the condition became normal, but maybe in future it will reoccur. Okay, come back. Okay, some condition will come back. The next one, earlier there was a surgery. So now that place, he has discomfort or she has discomfort. The next, there is a growth that's already been examined, but there are some changes. Okay, so first one is repetition, means reoccurrence, coming again, condition returned. Okay, then second one is uneasiness, discomfort, some difficulty, some problem because of the previous surgery. So is he talking about the medical condition and its recurrence, or is he talking about the surgery and the discomfort? Is he talking about the growth and the changes to that particular growth? What exactly the patient is concerned? Is he concerned about his medical condition? Is he concerned about his surgery? Or is he concerned about the growth? Or is bothered about the recurrence of the condition? Or is he bothered about discomfort because of the previous surgery? Or is he bothered about the changes due to the growth? Right. Now I'm going to play the audio.
Is there anything else that would like to Mr. Hollis?
Yeah. Now write down your answers. What do you think?
Sir, there was no voice. We couldn't hear.
Okay, sorry. 1 second. The computer I have to adjust again. Sorry for that.
I'm just wondering how I'm going to cope on my... So no problems on that score. Even if he does get very tired, he'll stick at it. I'm just wondering how I'm going to cope on my own at home. I mean, I'm capable of looking after him if he stays in bed, but I'm not sure about helping him to get up and stuff. He's a big man, and I have my own health issues.
Yes, of course. That's why I thought I'd have a word.
Get ready. You have to listen to the man's words.
Question 27. You hear a community nurse talking to a patient. Now read the question.
So that's your injection done. Is there anything else I can help you with today, Mr. Barnes?
Well, yes, nurse, there is actually. Could I ask you something? About 5 years ago, I had what's called a lipoma removed from my chest, about here. It was just a fatty lump that they said was harmless. Well, at the same time, I found another little lump, here, next to my nipple. Anyway, I was told it wasn't malignant, but to keep an eye on it. It's just that the other day I happened to knock it, and it went really red and painful. I mean, it's never bothered me before, and I never had any pain with the other one they removed. Could you have a look, please?
Well, I'm happy to do that, but I think you ought to go and see the doctor about it, really.
Question 28. You hear a discharge nurse talking to a patient who's had minor surgery. Now read the question.
Yeah, you can write the answer now. Write down your answers. Very good. C, C, B, A. Okay, fine. So, the possible recurrence of a condition, discomfort in the site of a previous surgery, changes to growth that has already been examined. Okay, so 3C and 1A. Okay, let us check the answer. 27 is C. 27 is C. Yeah, I found another lump, another little lump here next to my nipple. Anyway, I was told it wasn't malignant, but to keep an eye on it. It's just that the other day I happened to knock it and it was really red and painful. So that's the changes to that growth, a lump. Okay, so you can see there changes to a growth that's already been examined. So you can see I found another lump here next to my nipple. Anyway, I was told it wasn't malignant. That means already seen that one. And I was told it wasn't malignant. That means it was not harmful, it was not dangerous, but to keep an eye on it. So they told me to look after it. They told me to check and follow it. It's just that the other day I happened to knock it. So it was examined before only. This lump next to my nipple, it was already examined previously. Okay, they told not malignant, but be careful, keep an eye. That means monitor. So unfortunately, the other day I happened to knock it and it was really red and painful. So that is the changes. It became red and it became painful because he knocked it. A growth that's already been examined previously and examined and told that it was not malignant, but wanted him to keep an eye on it. So that was noticed by the doctor before, and he gave a suggestion that nothing harmful, but monitor. But unfortunately, he knocked it, and then it became red and it became painful. So those redness and painfulness are the changes, as noticed here. Right. So that's good. Next. This is the 28th question. Now go through this for 1 minute. Try to learn the art. Yeah. Now, so one by one, we will discuss this one. So first to start with Catherine. Catherine? Yeah.
Sure.
Yeah, share your experience. What do you think?
I didn't hear anything. There was no end.
Hmm.
Yeah, the conversation is between a discharged nurse and a patient who's getting discharged who had a minor head surgery.
Hmm.
So the patient is all worried about the patient needs a request that her family member also should join in the discharge process. So her concern is we should know if her concern is all about the next step in her treatment, or her concern is all about that she needs a chance to talk to the surgeon team, or is she allowed to take a further appointment?
Right. What about you, yeah, Philippa?
The question is all about a discharged nurse talking to a patient who had a minor surgery, and the patient is requesting either to have updates on the next step in her treatment, or to give the chance to speak to a family member, to give the chance to a family member to speak to the surgical team, or to allow either to allow the family member to attend a future appointment.
Yeah. Next, Simiat. Simiat. Simiat, you can unmute and speak if you can. Suha, you tell me your opinion, because everyone's opinion will be different. We'll learn new things from new people.
Yeah, I'm
Suha.
back. Thank you.
Yeah, Suha.
Hello.
Yeah, tell me what do you think? Before the audio plays, what do you think?
Yeah, before the audio, before I listen to the audio, I know this is about a discharged nurse that is talking to her patient that just had a surgery. So the patient is making a request and wanting the family to either be updated on the next treatment, or it to be given chance to speak to one of the surgical team, or to allow her to come to the next visit, attend a future appointment.
Yeah, of course. So that's very good. Yeah, what about you, Simiat?
That's Simia that just spoke now.
Yeah, Simiat. Okay, Suha.
Yes, sir. It's about discharge nurse speaking to a patient after he was undergone a surgery. I was confusing between A and B. Like I felt it for the first time. I felt it's the same, but I think the difference between A and B is that the information would be like the patient is requesting that information would be given to the family member, but on the B, that the family member maybe has some concern, so he will be asking the surgical team. And the third one is that if the co-patient or the family member is allowed to attend for future appointment and follow-up.
Yes, that's good. We have discussed. So everyone has a different idea. Not all have the same idea. So what you have to do is we will share like this one and we will learn so we can get perfect. We can become perfect. So now let us see. So according to our rules and regulations, so how are we going to study this question? So here, three things. First one is who is speaking. So who is the responsible medical professional? And then what is she doing? And the consultation is with whom? The patient or carer or who? And what is the background? Okay. So here there are four things. First one is the medical professional. Okay. So the responsible person, the in charge or the medical professional. So the person who is authority. Okay. Then next. So here you see the medical professional. Okay, who is responsible? Right, next one. This is a consultation, so talking. This is a consultation with a nurse or a discussion with a nurse. Don't think that it's consultation only with a doctor. This is, you can say, meeting. Okay, consultation with a doctor. So let us say meeting. This is a meeting. Okay, arranged scheduled meeting. And here the patient directly. Okay, so the audience who is listening to the medical professional. So audience. So then here this is the background. Minor surgery in the past. Who had minor surgery, maybe yesterday or day before yesterday or 1 week back. The patient is requesting. The patient is requesting. So who is requesting? The patient. The patient is requesting that what? A family member. So he's requesting a family member support. Where? Is updated on the next steps in her treatment. So patient is a she. Her treatment. Okay, her treatment. So patient is female. So you have to guess like this. It will be easy for you. Okay. Audience or patient is female. That's we are very clear. Okay. So is updated on the next steps in her treatment. Her means female. Okay. Next one. So medical professional will be a male person now. So medical professional will be a male person now. So two voices should be gender specific. So the patient is requesting. So you should listen to the patient's voice. That means female voice is more important here. Focus on females. Focus on female voice. Because she will tell. So she will be requesting. So request is made by the patient. So she is telling that a family member, her family member, should be updated on the next steps of her treatment. So focus on the. So now focus is already you understood what you should listen more. Okay, male you can ignore. Then is updated on the next steps of her treatment. Okay, next steps of her treatment. Updated means what should you do next? Future actions. So future actions, future programs. So future, she is bothered about the future activity. So this is regarding future. Okay. The next one is given the chance to speak to a member of the surgical team. Surgery is already over. Who has had a minor surgery? Surgery is already done. So he's given a chance to speak to a member of the surgical team. Okay. So this is focus on past tense. This is focusing on future. This is focusing on future. So future actions. This is focusing on past actions. Surgical team, past. Okay, surgery is already done. Who has had minor surgery? So surgery is already done in the past. So you can see here, surgical team. Okay, so a family member is given the chance to speak to a member of the surgical team. That's already past. So she or he can talk to the surgical team about what happened, why it happened, all these things. This is related to focus on past. He is allowed to attend a future appointment. So is allowed to attend a future appointment. So that is appointment. One appointment is there, future appointment is allowed to attend a future appointment. So this appointment, she came. Okay, the patient came. But she wants a member also to come along with her in the next appointment. So she is requesting, okay, that a family member be attend a future appointment. So is she talking about? Now let us see what's the main point here. Okay, is she talking about treatment in the future? Okay, is she talking about treatment in the future? Okay, is given the chance to speak to a member of the surgical team. So is he talking about surgery, which was done before? Is allowed to attend a future appointment, an appointment which is going to happen in the future. So Is it regarding treatment, or is it regarding appointment, or is it regarding surgery? So you have to focus like this. Okay. You have to focus like this. Right. Think about this very carefully. Think about this very carefully. So now I'm going to play the audio. Yeah. That's very, very important. Now let me play the audio.
It's never bothered me before, and I never had any pain with the other one they removed. Could you have a look, please?
Well, I'm happy to do that, but I think you ought to go and see the doctor about it, really.
Question 28. You hear a discharge nurse talking to a patient who's had minor surgery. Now read the question.
So, how are you feeling?
Much better, thank you. My son should be here shortly to pick me up.
Oh, great.
But I'm still a bit unclear about what happens next. I'm meant to be seeing the specialist again in about 3 weeks' time. But the doctor I just spoke to said that the endoscopy hasn't shown up anything in particular. So, do I still need to go to that one?
Well, as part of today's procedure, the team did what's called a biopsy. In other words, they've taken away a small sample of tissue for analysis.
Yes. Come to think of it, he did mention that. Oh dear, I'm afraid I wasn't really listening properly. I was still half asleep. Do you think you could just run through things with my son for me? I'd hate to get anything wrong.
That's no problem. We'll sit down all three together before you leave, shall we?
Oh, thank you.
Yes.
Question 29.
Yeah, now you can submit your answers. You can submit your answers now. So A. Okay, fine. So now let's take our answer. 28. 28 is A. Yeah. Do you think you could just run through things with my son for me? I would hate to get anything wrong. Okay. Do you think you could just run through things with my son for me? I would hate to get anything wrong. So she wants, okay, to have his son. Yeah. Is updated on the next steps in her treatment. I don't want to miss anything. So can you talk to my son? Do you think you could just run through, means update things with my son for me? I would hate to get anything wrong. So what are you talking? Okay. Can you discuss with my son? Because I don't want to do any mistake. So please talk to him. That's the meaning. Is updated on the next steps of her treatment. Yes, you're right. Next. 29. Yeah, go through this. 29. Yeah. So, Catherine, you can discuss.
Yeah, sir. So this 29th question is a conversation between two nurses. So one nurse is shift is getting over, and the other one nurse shift is she is in to her duty. So the question is, what does incoming nurse agree to do for the patient? So the outgoing nurse is giving an handover about a patient who is there in the ward. So her point is, will she be discussing all about the painkillers that she has to give the patient, or is it all about skin infection which is there, or is it all about a referral to the specialist?
Okay. Right. Next, Philippa.
Okay. It's about two nurses handing over, a nurse handing over to the incoming nurse at the end of a shift. So what does the question is, what does the incoming nurse agree to do? So my attention should be focused on the incoming nurse voice to know what he or she has agreed to do. So whether she agreed to review the is analgesia need, that means the patient is a male, or to report a possible skin infection, or to arrange a referral to a specialist. So I should focus on the voice of the incoming nurse.
Very good. Suha. Suha, everyone
Okay,
has different ideas, so all of you speak. Yeah.
yes. Okay. The dialogue would be between two nurses. They are making endorsement. Most of the information would be from the new nurse who is coming for the new shift. And she should be agree to do something for the patient. It's either something related to painkiller, to review the painkiller, or the patient is having a skin infection and she has to report. It's possibility, but she has to report, or the patient is needing referral for a specialist. Yeah, and she will arrange.
Yeah, good. Next, Simiat. You also share your opinion.
Okay, here we'll be having two nurses, and to differentiate one from one will be a male and the other will be a female, just to distinguish their voices. So I will pay attention to what the nurse that just came to take over wanted to do based on what it's been handed over to her. So I'll listen to what she wanted to crack on, either to review his painkiller or to check and report if he has got possible skin infection, or if she wants to refer the condition to a specialist.
Yes, good. Now, who is male and who is female? That we have to see now. Can you understand anything from here? No. We cannot understand. Now, in this situation, what we have to do? In this situation, what we have to do? Now, let us see here. You hear two hospital nurses. Okay. Two hospital nurses. Two hospital nurses handing over a patient at the change of shift. So, you hear two hospital nurses handing over a patient. Handing over a patient at the change of shift. So, it is the change of shift. So, what does the incoming nurse agree to do? Okay. So, the first nurse, maybe male or female. So, focus the voice first. Always the first nurse will be speaking because she's handing over the responsibility. There's the point here. Change of shift. handing over. So first nurse will speak first. Okay. Then, so is it regarding analgesia? Or is it regarding infection? Or is it regarding a specialist? Okay. Review analgesia. Report skin infection. Referral to a specialist. So what is more important here? You have to focus on the words. Analgesia means medication. Infection, skin infection, or is it a specialist? So focus these words more. So review analgesia. Without analgesia, there is no review. So review analgesia means finished, but review analgesia. If you just say review, there is no use. So analgesia is the main thing here. Report infection. So what report? If I say report is important, report what? You'll say infection. So infection is more important. Review what? Analgesia. So analgesia is more important. Arrange a referral. Referral to what? To whom? A specialist. So specialist important. So is he focusing? Is he accepting? First one, there may be three things or two things or one thing only or nothing. So the first nurse may be telling, okay, the second nurse, the incoming nurse, the person who starts speaking in the second place. First is first nurse going out. Second starts speaking, responding person is the incoming nurse. Remember that. If first one is a female voice, then automatically you have to give importance to the male voice, second voice. Remember that. Okay. Agree. First one, somebody says, I will tell you, will you come with me? Yeah, I will come. So first I'm saying, then you will agree. So first somebody should say, then you will agree. That's the condition here that you have to remember. So you have to focus on these areas. What is she agreeing to do for the patient? Is she agreeing regarding analgesia to review? Or is she agreeing regarding infection to report? Or is she agreeing to a specialist for referral? So what is the point? She says, okay. Okay for analgesia or for infection or for specialist. Review, report, refer. They are not important. Analgesia, then review. Infection, then report. Specialist, then referral or arrange, whatever. So this is how you have to focus on these words particularly.
Down all three together before you leave, shall we?
Oh, thank you.
Question 29. You hear two hospital nurses handing over a patient at the change of shift. Now read the question.
In bed 3, we have George, overnight emergency admission.
Okay.
George is a 66-year-old male with a suspected flare-up of gout. He's in for observation and he's scheduled for a rheumatology consult today. It's the right knee that's inflamed, but he claims never to have had such an attack before, so pseudogout's a possible differential diagnosis.
Right.
He self-medicated with ibuprofen before coming in, and a hydrocortisone injection was administered before transfer up here. Vital signs are all normal, no other meds.
Okay.
I noticed that he's got some sort of insect bite on his right ankle, so that same leg. It's red and swollen. He said it had come on since he arrived, but that it was nothing compared to the pain in the knee. But perhaps it's something to follow up with the duty doctor this morning.
Sure.
Question 30. You hear the beginning of a training session for healthcare staff in a primary care setting on the subject of patient consultations. Question 30. You hear the...
Yeah, now submit your answers for question number 29. Yeah. Now let us think about the answer. "29 is B. I noticed that he's got some sort of insect bite on his right ankle. I noticed that he's got some sort of insect bite on his right ankle. He said it would come on since he arrived. But perhaps it's something to follow up with the duty doctor this morning." Okay. So B, I noticed that he's got some sort of insect bite on his right ankle. He said it would come on since he arrived. It had come on since he arrived. But perhaps it's something to follow up with the duty doctor this morning. Okay. So the female nurse says, sure. She says, sure. That means she will follow. That's the point. Right. So, insect bite. Okay. To doctor, not specialist. Not regarding analgesia. So it is not analgesia. Okay. It is not analgesia. Okay. Insect bite on the skin. Okay. Arrange a referral to a specialist. No. Specialist, no. So report a doctor. Report a possible skin infection. Okay. It had come on since morning. So that's okay. Let me take you to the audio script. "29. In bed we have George. Overnight emergency admission." Okay. George is a 66-year-old male with a suspected flare-up of gout. He is in for observation and is scheduled for a rheumatology consult today. Rheumatology consult today, already scheduled. Already scheduled. That specialist already scheduled. It's not new. It's the right knee that's inflamed. But he claims never to have had such an attack before. So pseudo gout's a possible differential diagnosis. Then nurse 2 says, right. So male, female. He self-medicated with ibuprofen before coming in and had a hydrocortisone injection, was administered before transfer up here. Vital signs are all normal. So no problem with medication. Okay, no problem with medication. Okay. I noticed that he's got some sort of insect bite on his right ankle. So that same leg, it's red and swollen. He said it had come on since he arrived, but that it was nothing compared to the pain in the knee. But perhaps it's something to follow up with the duty doctor. So follow up with the duty doctor this morning. So follow up with the duty doctors regarding pain in the knee. Okay, right ankle swollen, red and swollen, insect bite. So that's the point. So it is not regarding medication. It's not. First one is regarding, see here. First one is regarding scheduled for rheumatology. He is in for observation and is scheduled for rheumatology. Already consultation is already there. That's a specialist. Okay, she said, okay, right. Okay. But not, not refer. Okay, arrange a referral. It's already arranged. Already arranged. Referral is already arranged for rheumatology. Okay, done. Then next, self-medicated with ibuprofen medication. So is this related to medication? No other medications. Vital signs are normal. So no problem with medications. So analgesics, no problem. Third one, I noticed that he's got some sort of insect bite on his right ankle skin. Okay, so that same leg, it's red and swollen. He said it had come on since he arrived. From the time he came, then it was there. But that it was nothing compared to the pain. But perhaps it's something to follow up. So you have to follow up. Follow up with the duty doctor this morning. So that's it. Yeah. Report a possible skin infection. Maybe skin infection because of redness and pain. Okay. So that's it. Next, 30. Question number 30. Go through this. Yeah. So, Catherine, explain me.
So here the question is all about here the beginning of a training session. So there is a session going on for healthcare staff. Healthcare staff means maybe all the people who are working in a hospital or in a community setting. So here the main facility is primary care setting, and the main agenda is all about a subject of patient consultation. So, what is the main focus on the session going to be? Means, what is the main aim or main reason of conducting the session? So, the options are alternative ways of setting up consultations. Maybe they want to find out different alternatives, how to set up a consultation, or maybe it is all about telephone calling. How can a patient and a doctor have a conversation through the phone? Or maybe it is all about a one-on-one session. That is meeting the doctor directly in the clinic or in a hospital or in a setting, a healthcare setting where they can have a one-on-one session.
Okay. Right. This is the beginning of a training session. Number one, just started. Beginning. So
Yes,
it's
sir.
not about everything. So you have to understand. Okay. Next, Philippa. I'm making you think like that so that in your exam it will be easy for you. Yes, please. Philippa. Okay, Suha.
Yes, okay. The scenario, the dialogue would be, it's not would be a dialogue, actually it would be just one way, as I guess. The information would be coming from a trainer, giving the staff information about consultation. The question is about the focus of the session. So it would be about alternate ways. I cannot think of alternate ways. It's either face to face or virtual, but or the focus is speaking about the telephone consultation, not the face to face, or how to decide when face to face and not telephone is needed.
Right. Next, Simiat.
Okay. So, at the beginning of a presentation, so we are to listen to, at the beginning of a presentation that is set up for training purpose in healthcare settings. And on the subject of patient consultation. So the question is, what are they focusing on? What do they want to talk about? So is it an alternative way to that is different from what they have been doing before? Or is it a telephone consultation, or is it face-to-face? So they want to, at the beginning, what they want to talk about is what we are to pick.
Right. Yeah. Philippa. Okay. So now let us go ahead. Listening. Yeah. This is talking about aspects of their work. Yeah. So Philippa is busy, I think. Okay. You hear the beginning of a training session for healthcare in a primary setting on the subject of patient consultation. This is regarding patient consultations. And who is the speaker? The trainer. And training session is going on and the trainees are listening, healthcare staff in a primary care setting. So what is the focus? What is the focus? Okay, on the session, it's patient consultation. Inpatient consultation, main what? What is the main? What is the focus of the session going to be? So, is it alternative ways of setting up consultations? So, consultation is common here. So, eliminate all consultations. Consultations. Okay, so that is no more important. Alternative ways of setting up consultations. Setup, alternative setup. Okay, alternative setup. So alternative, another mode, another model. Okay, not the what we are doing. It's an alternative model. How to make the most of telephone consultations? So telephone consultations. Ways of defining when face-to-face consultations. So here you can see what are the important things. The first one is telephone consultation. First one is telephone consultation. Remember that. Telephone consultation. Second one is face-to-face consultation. So telephone means here, face-to-face means okay, different ways or alternative ways, alternative, substitute. Okay, another model of consultation. So first one, these three words you have to focus on. Telephone means telephone. Okay, what is the focus on telephone consultations or face-to-face consultations or alternative ways of setting up consultations? So this is setting up. Okay, setting up, and this is deciding, ways of deciding when face-to-face consultations are necessary. So face-to-face, anyhow it is face-to-face, telephone and others. Remember that. So I'm going to play the audio now.
Question 30. You hear the beginning of a training session for healthcare staff in a primary care setting on the subject of patient consultations. Now read the question.
For those of us working in primary care, telephone consultations certainly bring benefits. The caseload's easier to manage because we can make more effective use of triage, meaning some patients get directed to other services without the need for a time-consuming face-to-face visit. But something's lost too, isn't it?
It is. One of the most obvious drawbacks is that you don't get those telltale non-verbal cues. These help us to see where the patient's coming from and what the patient's priorities are in all sorts of subtle ways that aren't always evident from the plain words heard down the line.
That's right. Well, today we'll be looking at ways to get round some of the issues and ensure these consultations are effective, like ways of checking that an explanation we're giving is making sense to the patient and whether the options we're sharing are something the patient feels comfortable with.
Yes. So that's the end of the audio. Part B.
That is the end of Part B. Now look at Part C.
Now what you have to do is, you write your answer A, B, C, D. Whatever answer is right, write down. Yeah. Yes, very good. Let us check our answers now. B, A, B, R, A, C, B. Okay. All right. Let us check our answers. D. Answer is B. Today, we'll be looking at ways to get around some of the issues and ensure these consultations are effective. Today, we'll be looking at ways to get around some of the issues and ensure these consultations are effective. The male speaker mentions face-to-face visits. It is only to make, okay? It is only to make the point that telephone consultations are less time consuming. In any case, there is no mention of setting up consultations. Although the female nurse mentions that useful non-verbal clues you get from face-to-face visits is missing. The male speaker makes it clear in the final session that the session is going to focus on telephone consultations and methods of improving communication in them. So, today we'll be looking at ways to get around some of the issues and ensure these consultations are effective. Which consultations? Now let us see here. Yeah. For those of us working in primary care, so see here in the beginning he's telling, for those of us working in primary care, telephone consultations certainly bring benefits. The caseload's easier to manage because we can make more effective use of triage, meaning some patients get directed to other services without the need for a time-consuming face-to-face visit. But something's lost too, isn't it? It is. One of the most obvious drawbacks is that you don't get those telltale non-verbal clues. These help us. Okay, fine. Trainer, that's right. Well, today we'll be looking at ways to get around some of the issues and ensure these consultations are effective. So which consultations? So for those of us working in primary care, telephone consultations certainly bring benefits. That's what he's telling. Okay. So on the most obvious drawbacks is right. What the patient's priors are in all sorts of subtle ways that aren't always evident from plain words heard down the line. That's right. Down the line, telephone. Down the line means on the telephone. Okay. Well, that's right. So telephone. Today we'll be looking at ways to get around some of, okay, the issues and ensure these consultations are effective. Which consultations down the line? So telephone consultations. So everywhere he's talking about telephone consultations. You have to remember here. So telephone consultations. Okay. Then down the line means telephone consultations. Okay. Some of the issues and these ensure these consultations are effective. Okay. Certainly bring benefits. So think about that area. Yeah. How to make most of telephone consultations. Talking about telephone consultations, drawbacks of face-to-face consultation and other ways. Okay. So all these things were not discussed. Okay. But here it was discussed about how to make the best in the underlined area. Right. So that is part B. Now we are going for part C. Part C. Yeah, this is part B. Okay. Sorry, that is part B, right? Maybe the part C. Yes. Now, part C. Have we done this already, part C? No, Kulkarni. Dennis Bronner. Okay, that is part C reading. This is part C listening. Yeah, part C listening. Yes. So you hear an interview with an occupational therapist called Dennis Bronner, who is talking about her work and training. Okay. Right. Now, this is an interview and it is an occupational therapist. This is an interview. This is an interview and there is an occupational therapist called Dennis Bronner, who is talking about her work. Her means this is a lady and the male person is the interviewer. And the male person is the interviewer. Okay. Male person is the interviewer and interviewed regarding her work and the training. What is her work and what is her training? So all these things. So we are going to discuss. That is number one. We study this question. So think about this question in the same manner. Yes. So who is there? Suha, you can speak.
Okay, it's she is an occupational therapist, Denise. She worked at Animal Rescue Center. And the question is that she realized something. So this would be something that she would say that this has caught her mind or something. It's something about policy towards dog owners, or something about reuniting dogs, and she found the idea is unrealistic. Reuniting dogs with owner, or something related to like the dogs are I don't know how to say this, or it's like a support between the owners to their dogs.
Good. Good. Okay, Simiat, what is your opinion?
Yeah, okay. This is talking about an occupational worker who works at Animal Rescue Center. So she came to know that that the center that the policy is misguided, that her idea is unrealistic. That means to reunite the dog, and also the dog represents a valuable source of support. Here, support, did we hear anything about support to the owner? Did we hear anything about policy which is misguided towards the dog owners? Or did we hear an idea from her to reunite dogs with their owner being unrealistic? So those are what we'll be trying to listen to.
Very good. Philippa. Philippa, unmute and speak. Okay. Now let us play the audio. Okay, question after question. Every question it will change because this is an interview. So first male person will be asking and then she will be answering. Like that it will be. So one turn, one male and one female, one question. One male and one female, second question. One male, one female voice, third question. One male, one female voice, fourth question, like that. So be careful. Right. So we'll go for the third part.
Track 44. Test 6. Listening. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. Track 45. Test 6. Listening. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with an occupational therapist called Denise Bronner, who's talking about her work and training. You now have 90 seconds to read questions 31 to 36.
So this much time you have to read all the 6 questions, not for one question, remember that.
Today, I'm talking to Denise Bronner, an occupational therapist who's going to give some insights into her work and training. Firstly, Denise, how did you get into occupational therapy?
Well, I actually started out as a dog handler in an animal rescue centre. Obviously, the centre's work was focused on animal welfare, but I ended up doing a fair bit of liaison work with the dog owners. These were often people with medical conditions who were very dependent emotionally on their pets, but who sadly could no longer care for them full time. So the dogs would spend time with us. Seeing how both the owners and the dog's quality of life was suffering as a result of the separation was an eye-opener for me. With my employer's encouragement, I set about seeing how many could be reunited simply by providing a bit of practical advice to the owner with surprising levels of success. By chance, I'd stumbled upon the field of occupational therapy.
So where did that discovery take you?
It led me to a job in residential care. I was working with vulnerable young adults from a range of backgrounds, with learning disabilities, a diagnosis of autism, or mental health conditions. I'd help these teenagers overcome barriers and engage more fully with the life of the community. What I found particularly satisfying was the notion of providing all-round care, not just focusing on their mental or physical health. I got to work with a 14-year-old boy whose irrational fear of dogs was actually preventing him going out alone. So I took him to the animal rescue centre and gradually acclimatised him to being around dogs. I realised that improving somebody's quality of life like that's a really worthwhile thing to do. So I decided to train as an occupational therapist.
So tell us something about that training.
Well, there are very...
So whenever it shifts, male voice, female voice, male voice, female voice, like that. So that means topic changed. So we'll go to the next question. Now let us see. Yeah. Now think about this. What is the answer for this? 31 question. 31st question. Now write the answer. What do you think is the answer? So A and C. The center's policy towards dogs owners was misguided. Her idea of reuniting dogs with their owners was unrealistic. Some dogs represented a valuable source of support for their owners. So we got 3 answers so far. A, C, and B. So all the answers are right according to you. One says A, one says B, one says C. So all the answers are right according to you. Let us check the answers now. First answer, 31st answer is C. 31st answer is C. Okay. Seeing how both the owners and dog's quality of life was suffering as a result of separation was an eye-opener for me. So it opened up my eyes. That's what she's telling. Okay. So some dogs represented a valuable source of support for their owners. So how they are related to one another. It was an eye-opener for me. Mutually interdependent. So seeing how both the owners and the dog's quality of life was suffering as a result of the separation was an eye-opener for me. Because they have separated, they were suffering, both the owner and the dog. Both quality of life was suffering. Without the dog, the owner was suffering. Without the owner, the dog was suffering. So it was an eye-opener for me. So I try to understand that. So she realized that, okay, some dogs represented a valuable source of support for their owners. That's what it is. Right. So listening, part C. Next question.
Sorry to interrupt. Yeah, actually, I did not hear anything about policy, but in the B option, it was realistic, and here it was unrealistic. So I did not go for it because it is realistic. But the C aspect, she said they are both suffering. So when they are both suffering, I just and here it's saying they are source of support. So I thought, since they are suffering, that there is nothing that, if they are really source of support, they shouldn't be suffering. That is why I didn't go for C.
Yeah. Actually, the thing is, the dog was suffering. That's okay. But the owner also was suffering. That means why? Because the dog is not there. So that means dog is there. They were not suffering. That means it was a valuable support. Presence of dog. Absence of dog caused suffering. So if no absence of dog, then suffering will not be there. That means it will be support. Okay. You understand now? It was a reverse angle. It was given. Right.
Yes, I understand now. Thank you.
Yeah, that's very clear. Next, 32nd question. That is second question. I'll show you from the beginning again how the topic is shifting. You see, male voice. So interviewer starts the interview and Dennis responds to the interview questions. Remember that. So I'm starting from again. How it is changing. One question is asked, answer is given. That is the first question. Then again one question is asked by the male person, then female person will be speaking. That is the second question. Then next again question, answer becomes third question. Question, answer becomes the fourth question, like that. For every question there is a rotation. It's called cycle.
Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with an occupational
is changing
therapist
the
called
topic.
Denise Bronner, who's talking about her work and training. You now have 90 seconds to read questions 31 to 36.
We have question 31 on the screen.
Yeah, I gave text to question 1 only. Now we are waiting for the time to move. So how much time? You are guessing how much time is there for you to go through all the 6 questions. I'm making you practice.
Okay.
So it will start from here. Then when the voice changes from male to female, that means 1 question. Then again male comes second time. That means second question, 32nd question. That's how you have to understand.
Today, I'm talking to Denise Bronner, an occupational therapist who's going to give some insights into her work and training. Firstly, Denise, how did you get into occupational therapy?
Well, I actually started out as a dog handler in an animal rescue centre. Obviously, the centre's work was focused on animal welfare, but I ended up doing a fair bit of liaison work with the dog owners. These were often people with medical conditions who were very dependent emotionally on their pets, but who sadly could no longer care for them full time. So the dogs would spend time with us. Seeing how both the owners and the dogs' quality of life was suffering as a result of the separation was an eye-opener for me. With my employer's encouragement, I set about seeing how many could be reunited simply by providing a bit of practical advice to the owner with surprising levels of success. By chance, I'd stumbled upon the field of occupational therapy.
So where did that discovery take you?
It led me to a job in residential care. I was working with vulnerable young adults from a range of backgrounds, with learning disabilities, a diagnosis of autism, or mental health conditions. I'd help these teenagers overcome barriers and engage more fully with the life of the community. What I found particularly satisfying was the notion of providing all-round care, not just focusing on their mental or physical health. I got to work with a 14-year-old boy whose irrational fear of dogs was actually preventing him going out alone. So I took him to the animal rescue centre and gradually acclimatised him to being around dogs. I realised that improving somebody's quality of life like that's a really worthwhile thing to do. So I decided to train as an occupational therapist.
So tell us something about that training.
So that's
Well, there are very engaging lectures and workshops.
Yeah. So now tell me, what is the answer? So 32. 32. Question number 32. Yeah. Now you can submit your answers. B. Still says B. Okay, what about others? Richmond says B. So 2 Bs. What about the others? So there are still 3 more. So only 2 students have given the answer B. What about the rest? Yeah. So Abdul Rahim B. Okay, fine. So now let us think about these answers. Yeah. Fazle Razik. Okay, good. Welcome, Fazal. Right. So first, let us start with Simiat. Yeah, Simiat.
Yes, sir.
Why do you think he is the answer?
Actually, she initially mentioned the holistic nature of the support that she provided, but later she gave an example of a child that is scared of dog, whom she took to the where she worked before. So I was confused, but I ended up that if you have a good, the holistic nature means it covers everything. So which includes her taking the child to where she took him to. That is why I ended up picking B.
Yeah, that's right. That's good. Okay. Now here, the point is very clear. One word, holistic. What is the word instead of holistic that you have heard? Do you remember? Okay, next. Suha. Suha is there? No. Rabia. Rabia just joined, I think. Yeah, Philippa. Philippa. Philippa, you can explain. Yeah, anybody else can explain? Richmond. You explain your version because everyone has a different way of seeing. So if we share our different ideas, we'll understand. Then when I explain, then you'll understand what mistake you have done or what more can be added to that. Yeah, Richmond, you can speak. Okay, fine. Rabia just joined. So fine. Next question, we'll see Rabia. Right. Now, what did Dennis find? What did Dennis find particularly rewarding? Rewarding means beneficial. Rewarding means, okay, no problem, Richmond, no worries. Okay, no worries. So, what did Dennis find particularly rewarding about her job in residential care? So, this is the second round you have seen. Okay, the wide range of people she got to work with, the holistic nature of the support that she provided, the opportunity to use some of her previous experience. So, wide range of people. Wide range of people means diverse people. Then the second one is holistic nature of the support that she provided. Holistic nature, complete, all round. So you heard the all round word there. The opportunity to use some of her previous experience. So previous experience was rewarding. So first thing is many different types of people she was working with. So is that rewarding? Her holistic support she was providing to others, that was rewarding. Her previous experience helped her, that was rewarding. So now let us see the answer. That is B. Yeah. So in B, you can see very clearly here. What I found particularly satisfying was the notion satisfying, particularly satisfying means rewarding, was the notion of providing all-round care. All-round care means holistic. Holistic, the word's a synonym. All-round means holistic. All-round care. The patient is mentioned as an example of all-round care. That means brackets holistic. So the meaning is holistic. What do you mean by holistic? If you don't know the meaning, it will be difficult for you to understand. Okay. Now I'm going to show you here. Right. Holistic. Cambridge Dictionary. Holistic. Holistic means what? Dealing with or treating the whole of something or something and not just a part of it. Means all round. Okay. Holistic means all round. All in one piece. All in one. These are all different meanings. Okay. Fully. Okay. Full length. Holistically. Holistic. Relating to the whole. Means complete or full. All round development. That's all round. All round means holistic. To remember that. Okay. So, holistic nature of the support that she provided. Yeah. Holistic nature. Holistic nature means all round. So you have to understand the synonyms. If you don't know the synonyms, it will be difficult for you. All round development. All round means holistic. And you have to remember that. Holistic. Then next question. 33. Yeah. Yes, here is the 33rd question. This is the 33rd question. So analyze this question. Yeah. Third one. What does Dennis highlight about her occupational therapy training? Highlight regarding training. Yeah. So, what does Dennis highlight about her occupational? Yes. Yeah. So, what does Dennis highlight about her occupational therapy training? What does Dennis highlight about her occupational training? So, highlight means more important, means extraordinary, special about her occupational therapy training. What is a great thing? So, how challenging it was working in such a wide range of environment. Challenging means very, very difficult. Okay, very, very problematic, very troublesome. Okay, how effectively theory and practice complemented each other. So, theory and practice, how effectively theory and practice complemented each other. Okay, supported each other. Theory and practice. Theory and practice. Training and practice. Okay, complemented each other. How broad her background reading. Okay, how broad her background reading was required to be. So what is she telling actually? Is it telling that working was very challenging? It's very difficult, complicated? Then A, theory and practice. So one side theory, one side practice. What is she learning in theory? She is using in practice. What she is listening in practice is helping her to understand theory. What she is reading in theory, she is able to put into practice. What she is experiencing from practice, she is going to improve her theory knowledge. So like that, together they are going complementary, hand to hand. Together they are helping one another. What theory is helping practice, practice is helping theory to understand. So her broad, how broad her background reading was required to be. So she had to read more reading background. Okay, regarding her training, she had to do lot of reading. So is she talking about challenging conditions, or is he talking about theory and practice, reading and doing? Okay, theory and practice means study and training and work together. Then third one is reading. Too much of reading is required to understand the topics. So that's it. So is he focusing only on reading, extensive reading, or she is talking about theory and practice, or she is talking about the problematic situations? So, right. Now let us play the audio. I'll pull a little back so that you'll know how it is changing from topic to topic.
Care, not just focusing on their mental or physical health. Like, I got to work with a 14-year-old boy whose irrational fear of dogs was actually preventing him going out alone. So I took him to the animal rescue centre and gradually acclimatised him to being around dogs. I realised that improving somebody's quality of life like that's a really worthwhile thing to do. So I decided to train as an occupational therapist.
So tell us something about that training.
Well, there are very engaging lectures and workshops with a focus on problem-based learning, something that proves super helpful when you're out on placements and get to apply those principles, because that's where you really get to hone your skills. You learn on the job rather than from books. And those placements are in markedly different settings. Like my first and second year placements were totally different. And that's really exciting. But basically, wherever you are, you focus on the patient in front of you. You've got to become an all-round healthcare professional, able to combine the biological, social and psychological aspects of medicine. That's what gives the career its diversity and challenge.
Tell us about those placements you
Next
did.
question.
Well,
That is
the
next
first
question.
one was in a hospital intensive care unit. I learned so much. I even got the opportunity to observe surgery.
Yeah. So there's the next question, third question, because again man changed. Okay, fine. Now give you a okay, 33rd question. Come on, submit your answers. So Phil says A. Yeah, what about others? Rabia says A. What about others? Two more are there. Abdul Rahim. Okay. Which one says B? Okay. Now let us check the answer. Yeah, 33 is B. 33 is a B, not A. Okay, now let us check here. There are very engaging lectures and workshops. Lectures and workshops. So lecture and workshop. Lecture is theory, workshop is practice. So theory and practice. Try to understand this. So there are very engaging lectures. Lectures mean theory, and workshops. Workshops means practice. With a focus on problem-based learning, something that proves super helpful when you are out on placements and get to apply those principles. So here, there are principles in lectures. And these principles which you will learn in lectures, we are applying in the workshops. So theory and practice, they are helping one another. Okay. Application. What you learn in theory, that is lectures, you are applying in the practice, that is workshops. So try to understand, you have to be very careful. Okay, something that proves super helpful when you are out on placements in work and get to apply those principles which we learn in lectures. That's it. Okay. Next. Yeah. Thirty-four. Yeah. Go through this question. We have three more questions, 34, 35, and 36. Go through the question and try to understand first. That's more important. Before the audio comes, you should understand what is the question speaking. Yeah. The main means most important thing. Dennis learned something new from her placement in an intensive care unit. Was intensive care unit. See, be very careful when he says intensive care unit. When she says intensive care unit. Okay, the value of effective multidisciplinary teamwork. Multidisciplinary teamwork. Multidisciplinary teamwork. So teamwork as a team. The best way of monitoring each patient's progress. Monitoring progress. The need to adapt her input to a specific setting. Adaptation. Adapt her input to a specific setting. So the need to adapt her input to a specific setting. What she learned, that she has to adapt it to a new setting. Okay, adaptation means adjustment, modification. So like that. So is it working with others or monitoring patients or adaptation, adjustment? So this is working together. First one is together, not one person. It is group, working in a group. First one is working in a group. Second one is, okay, right, the best way of monitoring each other's progress. So monitoring, okay. So being watchful, observation. Third one is adaptation. Adapting herself to every situation. Everywhere she goes, she will get well adjusted. Okay, she'll say, I don't know this. No, she will get adjusted into that one, to any new specific setting. So that's it. Let us now listen to the audio.
Healthcare professional, able to combine the biological, social, and psychological aspects of medicine. That's what gives the career its diversity and challenge.
Tell us about those placements you did.
Well, the first one was in a hospital intensive care unit. I learned so much. I even got the opportunity to observe surgery to gain a deeper understanding of anatomy and how that affects my own practice. I was working with a group of dynamic and knowledgeable professionals, including doctors, nurses, physiotherapists, and healthcare assistants. It was great bouncing ideas off each other to find the best solution for the patient. They enter the unit at their most vulnerable. You then follow them through till you're planning their discharge and ongoing support. Being part of that journey taught me the value of concerted effort and coordination. When you're dealing with intensive care, that's how it has to be. But it holds true for all healthcare, actually.
And the second placement?
Question change.
That was on a stroke unit, and
yeah. So now, question number 34. Now submit your answers. Question number 34. Okay. Right. A. Abdur Rahim. A. Rabia. A. Then Phil. A. After I give the number, you can send it so that I will be able to understand. Okay. All of you say A. Okay. Now let us go and check 34th answer. Yeah, 34th is A. Okay. It was great bouncing ideas of each other, find the best solution for the patient. So it was great bouncing ideas of each other to find the best solution for the patient, being part of that journey. Okay, journey means together. Okay. The value of concerted effort and coordination. Concerted effort. Concert. Concert means a place, meeting place. Okay. Concert means meeting place. Concert means all together join at one particular place is a concert. Okay. And coordination, coordinate with one another. That is the point. Okay. Right. working together with others, teamwork. Right, next one. 35. So 35. Yeah. What aspect of Dennis placement in the stroke unit? First one is intensive care. Second one is stroke unit. So there will be a topic called stroke unit. Next, when the man changes. So man, male voice, female voice. Then again, male voice comes. That means next question. Okay. So fifth question. That means fifth round is fifth question. Sixth round is sixth question. What aspect of Dennis placement, okay, in the stroke has since proved most useful to her? Most useful to her. Okay, since proved most useful to her. Being given responsibility for own project. So responsibility for her own project. She had her project and that was responsibility given to her only. Next, working with patients from a particular age group. Okay, age group. Age group, working with patients, same age group. Gaining experience of a key skill in her specialism. Key skill in her specialism. So own project or age group or skill. Own project or age group. Project, age, skill. So the keywords are project, age, skill. One particular skill, one particular age group, one particular project. Her own project, particular same age group, patients. So one particular skill in her specialty. So you have to focus on these areas. Check when the words woman's voice, male voice is coming after the female voice. And that means your answer is coming.
Vulnerable. You then follow them through till you're planning their discharge and ongoing support. Being part of that journey taught me the value of concerted effort and coordination. When you're dealing with intensive care, that's how it has to be. But it holds true for all healthcare, actually.
And the second placement?
That was on a stroke unit and a completely different experience, but no less valuable. I was helping patients to develop skills and strategies to support them when they eventually left us, like cooking and social skills. My tutor was incredibly supportive and guided me in setting up a creative arts program. I was able to run those sessions independently, which gave me a lot of satisfaction. I also learned a lot about risk assessment. That was invaluable, and it stood me in good stead because it plays a big part in occupational therapy practice. I also appreciated getting to work with a more mature patient cohort because that was new too. Though, actually, it did help me see that geriatric care wasn't really my strength.
Can you tell us about one patient you helped during that placement?
When the male voice comes, that means question number changes. Remember. Yeah, now I'll give you the number. Then only you type the answer. 35. Yeah, now type the answer. 35. So Phil says A. Abdul Rahim says C. Rabia says B. Yeah. Which one says C? Okay, now let us check the answer. 35 is C. 35 is C. So risk assessment. So I also learned a lot about risk assessment. Risk assessment is one special skill. Risk assessment. That was invaluable and it's stood me in good stead because it plays a big part in occupational therapy. That is her specialty. Occupational therapy practice is her specialism. So the skill is risk assessment. Risk assessment in occupational therapy is very important. So C is the right answer. Yeah. What aspect of Dennis placement in the stroke unit? Yeah. Gaining experience of a key skill, that is risk assessment. One key skill, risk assessment. In her specialism, the key skill is risk assessment. One particular skill she mentioned is risk assessment. In her specialism is occupational therapy. You should remember that. Her specialty is occupational therapy. In the beginning only we have learned that occupational therapist. Her specialism is nothing but occupational therapy. So key skill is risk assessment. So you have to go through like that. Next. 36. Yeah, last question. Last question. After that, I have a personal class for Rabia. She's a regular student. Okay, whenever I am free, I will be giving classes like this. So personal classes will be there for the registered regular students. Okay. So Rabia, you are there, so be ready for your class because you already scheduled yesterday. In the case of patient called Malcolm, Dennis' talk was 2. So here a case called patient called Malcolm. This is a case. So that is the last question, last round. Okay, 6 rounds of questions will be there. Introduction will be there, conclusion. First paragraph is introduction, last paragraph is conclusion saying thank you. Okay, so 6 rounds will be there, 6 questions and 6 answers. So now this is going to be the last question of the interviewer, and yeah, Dennis will be answering. Dennis' task, what was the task of Dennis? Was to help him find the motivation to make progress. Motivation. Convince him to adhere to an exercise program. Exercise. Give him practice in strategies he'd need after his discharge. Strategies. So motivation or exercise or strategy. Motivation to make progress. Exercise program or strategies after discharge. So motivation, exercise, strategies. So motivation to make progress in life. Exercise. Convince him to adhere to an exercise program. Physical exercise. Giving him practice in strategies he'd need after his discharge. Strategies, approaches, techniques. Okay. Now let us play the audio.
Therapy practice. I also appreciated getting to work with a more mature patient cohort because that was new too. Though, actually, it did help me see that geriatric care wasn't really my strength.
Can you tell us about one patient you helped during that placement?
Yes. The one I recall most vividly is Malcolm, an 82-year-old male. After his CVA, he was struggling to walk, couldn't dress himself or manage in the bathroom. What's more, he couldn't seem to think through these problems. He'd effectively given up trying. I was told to turn that around. Together with the physiotherapist, I put together a functional and cognitive rehabilitation plan following an assessment of Malcolm's routines, hobbies, and home environment. We created a bespoke plan that showed him that it was worth engaging with how to perform daily tasks. After a fortnight, Malcolm was well on the way to regaining enough independence to return home.
Yeah.
Now look at extract 2.
That is the next extract. We'll see later. We'll conclude with this one now because I have a session. Okay. Now, in the case of the patient called Malcolm, Dennis' task. Now, question number 36. I will type here 36. Now you can submit your answers. Yeah. So, Rabia says A. Then Richmond says C, Rabia A, then Phil A. Okay, fine. Let us check the answer. So the answer 36 is A. He couldn't seem to think through these problems. He couldn't seem to think through these problems. He would effectively given up trying. I was told to turn that around. See here, he couldn't seem to think through these problems. That means it is difficult to come out of these problems. He'd effectively given up trying. He started trying. So he needs motivation. He needs motivation. He given up trying. So I was told to turn that around. So to take up trying again. Given up. He already gave up trying. Means he stopped. He stopped. So he felt I cannot. So he was demotivated. So I was told to turn that around. That means again motivate. Make him to start again. Start trying again. We create a bespoke plan that showed him that it was worth engaging with how to perform daily tasks. So try to understand. He gave up trying and I was told to turn that around. He stopped trying. So I want to start trying again. So that is reverse. He gave up trying. He did not know how he could see this problem, come out of these problems. So he effectively given up trying. Successfully, effectively means successfully. Gave up means stopped trying. So I was told to turn that around. He stopped trying. I was told to make him start trying again. So try to understand. So motivation here. He was demotivated. He was demotivated. So I have to motivate him again. That's the point. So little. Yeah, help him find the motivation to make progress. Motivation. Okay. So she gave him a task. So that made her progress. So help him find the motivation to make progress. So now coming to the point. Yeah. So that's it. Simon sir is here. Okay. Fine. Now, yeah. So let us talk to one by one. Okay. Adigwe. Philippia. Yeah. Do you want to share something? What benefit you got today? We have seen part A, we have seen part B, we have seen part C. If you did not attend, you can watch my video. I'll send you the link. I already sent the link in the group. Yeah, come on.
Okay, thank you very much, sir. In summary, I was able to know how to focus on the main points of getting the answer to the audio. One of them was being able to recognize the voice I should focus on. Then how to get the question answers as well with the analysis you gave to us today. So I really appreciate it.
That's very good. That's very good. Okay. Next, let us talk about Rabia. Hello, Rabia.
Hello, sir.
Yeah, how was the session? How did you feel? Was there some benefit for you?
Yes, sir, it was very beneficial as the main thing which I think, lacking behind was the how to assess the synonyms for the particular words. So it really helped me.
Good. Good, that's really good. Then next, Abdul Rahim, Simiat Abdul Rahim.
Yeah, to start with, thank you so much. You actually brought me out of my shell, because if I didn't stumble into this as I need it mostly, I will be sleeping. But I attended the class and it's very beneficial. So I was able to deduce the change of voice, especially in this part C, that when the conversation is ongoing and you realize that the voice has changed, so you quickly move to the next question. And also to focus on the keywords that might have synonyms, because they will not put it directly as it is in the question. But when you've highlighted the word, that is the key focus. Just try to give it a synonyms that might, or try to listen to it well and try to find the synonyms that might go. So which you actually taught as a part of the strategies. Thank you so much, sir. I really appreciate. Thank you.
Hello. What's the name? Simiyat, you invite your friends to attend the show. Many sessions I am giving. So you can ask them, just send the link. Okay. Send the link. They also can attend. Then afterwards, if they're interested, they can join. Like how you are joining, right? Yeah.
Okay, sir.
Yeah.
Yes,
Send
sir.
out, add your friends to the group. Add your friends to the group. They will get benefit. Richmond. Hello, Richmond. Richmond, are you busy still? If you are not busy, you can share 1 or 2 words so that we can close the session and I can go for personal class because it is Ireland time, going to be 2 p.m. Yeah. Yes. Richmond, you can speak. You're unmuted, but you're not speaking. You can speak. Do you have any problem with the mic? I think so. Okay. So that's all. So we end up for now. Then let me finish my personal class. Then afterwards I'll get back. And once again, I'll be active in the group. Then you can come and join once again. Thank you all. Have a nice day. And those who are watching on the YouTube, if anybody is interested regarding our sessions, writing or reading or listening or speaking or whatever, all around development. So if it is do or die situation, then only come to me. If you have 3 or 4 chances to work hard and afterwards lose and then come to me, that is not going to benefit. So if you want to come to me, you have to work hard, finish in one go. Like that it should be. Thank you all.